I'm Craig Cooper. I'm the CEO of Positive Life New South Wales. From a community and a people living with HIV perspective, it's mainly around people having information, knowing what services are available to them, and then being able to make some decisions around what their service options are in a given context or scenario and what would work for them. So basically, from a health service provider perspective, whether it be a HIV specialist or another type of health service, when you get a diagnosis of HIV and then you're referred over to a HIV specialist or other type of HIV program, whether it be a community program or a peer-based organisation, how you're linked into care, retained in care and referred through those services can sometimes be a bit tricky to navigate. The risk is, or the problem could be, that people don't follow through with the referrals and can sometimes be lost within the system. Making sure that people are linked into care and retained in care and navigate through a referral process is really important so that they know what their treatment options are. They can be involved in treatment decision making. Issues around adherence can be discussed, and then in terms of improving people's health outcomes, that people are aware of what the implications will be if they're on treatment, and if they don't go on treatment or don't start treatment, what that could mean for them personally. So basically, it's about self-determination and it's about empowerment. If people don't have the information, they don't know what their options are, because typically these services aren't always easy to find. So if people don't have the information and don't know what the options are, they're not going to be able to be linked into care, and they're not going to be able to be retained in care, and they could fall through the gaps and then potentially become quite unwell. So in terms of people affected by HIV or at risk of HIV, or people living with HIV, the issue is around informed decision making. So a lot of times there can be comorbidities and multimorbidities, and in terms of how you care coordination, what is called care coordination, or how people have a continuity of care from one service provider to another, ensuring that there is some type of service or program in place to actually help people transition through those arrangements. It's really critical, it's quite important. The other thing is, in terms of treatment decision making, if people don't have the information that they need or aren't fully aware of what's going on for them, then they can't be actively involved and an equal in that treatment decision making moment or in that continuity or continuum of care. So the empowerment perspective, or the issue around making sure decisions are made on as much information as possible and coming from a position of self-determination, this program in this way actually helps people to be able to make informed decisions and to actively participate in a clinical or a treatment decision-making moment. So the types of services that would be available would be general GP and primary health care. There could be specialist HIV prescribers. There could be community health organisations or community organisations such as Multicultural HIV, ACOM, Positive Life New South Wales. There's a whole range of service partners and service providers out there that, depending on what the issue is for the person, could potentially meet their needs and provide a different service to them and for them. So typically a lot of it will occur through referral and through the treating or diagnosing clinician. So whatever the point of contact is within the health system or the non-government organisation, typically they will find out about it through the service provider, or if they're searching online. So typically you could do searches around particular search terms, such as a peer support program, HIV peer support program, or where to go for a HIV test, so you would be able to search some of that stuff, and then you would get a number of options that could pop up for you. So typically the referral or the information will come from a health service provider, or it could potentially come from the internet.